Thanks for watching TMA's Legislative News Hotline for Friday, February 2nd. I'm Marcus Cooper, sitting in for my colleague Brent Anir. Here's what we're reporting on this week. TMA unveils its legislative agenda, Healthy Vision 2025 for physicians and patients. The white coat invasion is heading to the Capitol next week. But first, the House and Senate Budget Writing Committees begin deliberations. 3 weeks into the session, both the House Appropriations Committee and the Senate Finance Committee are meeting and talking about the issues that will impact the budget over the next 2 years. Representative Dr. John Zerwas, chair of House Appropriations, launched the committee into discussions this week about the status of the state's Rainy Day Fund, estimated to have a balance of more than $15 billion by the end of the 2-year budget cycle, and the ongoing cost of Hurricane Harvey recovery. Senate Finance Chair Senator Jane Nelson indicated her committee will begin discussions on the Texas Medical Board, other healthcare agencies, and Article 2, which covers Health and Human Services next week. TMA Council on Legislation Chair Dr. Jason Turk says now is the time to push TMA's top legislative priority.
There has not been in recent times a better moment for us to improve the situation that we have with Medicaid, and that we must be bold and make sure that our ask is for something substantial, and we need to make our voices loud and clear, because I assure you other forces will be wanting some of that money. It is time that we improve payment for physicians in the Medicaid program, which is going to help access to care for so many people in Texas.
Last week, the House and Senate members received their highly anticipated committee assignments. Here are the key players on the committees important to Texas medicine. Senator Drs. Donna Campbell of New Braunfels and Dr. Charles Schwartner of Georgetown will serve on Business and Commerce, chaired by Senator Kelly Hancock. Senator Dr. Campbell will also serve on the Senate Finance Committee, chaired by Senator Nelson. Senator Drs. Don Buckingham of Lakeway and Dr. Campbell will serve on Health and Human Services, chaired by Senator Lois Kolkhorst of Brenham.
I want to tell y'all that you're well represented in the Texas Senate. There are 3 doctors in the Texas Senate, and by the numbers that means 10% of our membership is made up of doctors.
Senator Kolkhorst spoke at TMA's winter conference about the Health and Human Services Committee priorities this session. We'll hear more from her in a few minutes. Over in the House, the Appropriations Committee, chaired by Representative Dr. Zerwas, includes Representative Dr. Greg Bonnen of Friendswood and Representative Dr. J.D. Sheffield of Gatesville. The House Insurance Committee includes Representative Dr. Bonnen, newly elected Representative Julie Johnson of Carrollton, a member of the TMA Alliance, and Representative Dr. Tom Oliverson of Cypress. Representative Dr. J.D. Sheffield will serve on the Public Health Committee, chaired by Representative Sinfronia Thompson of Houston. As we mentioned earlier, Senate Health and Human Services Chair Lois Kolkhorst touched on several of medicine's legislative priorities during her presentation Saturday at the TMA Winter Conference. The Senate's proposed budget allocates nearly $85 billion for health and human services overall, but she says it will take a serious financial commitment to grant physicians a long overdue pay bump for seeing Medicaid patients.
As we increase Medicaid rates to want to pay you more, just a little bit costs hundreds of millions and sometimes billions of dollars. And that frustrates me, because I look at some of the reimbursement rates that you receive and I go, gosh, that's just not enough.
We're joined now by TMA's Director of Legislative Affairs, Dan Finch. Dan, we were at Winter Conference. We heard the comments from the Senator about Medicaid. What was your takeaway, and what's your thoughts on where we are on the issue?
First of all, thank you, Marcus. Senator Kolkhorst is, and having her at our conference talking to the several hundred physicians there was very important moving forward. As the new chair of the Senate Health and Human Services Committee, Senator Kolkhorst will have jurisdiction over a goodly number of the issues that affect physicians in healthcare in Texas. And one of those issues is, of course, Medicaid. And Medicaid is a huge budget item for the state, and it does cover a large and diverse population, but it covers it in a manner, at least in the way that it is funded, that for physicians have not seen in 20 years a payment increase in the Medicaid program. And so it's harder and harder to keep physicians in this program taking care of patients who have significant medical needs. That's number one. Number two, because it is such a large part of the state's budget, it generally, we always seem to come to as part of the session where, in order to balance our budget, we short the program for funding for a month or 2 months, and do not allow for enrollment growth, for service growth, for acuity growth, so that when the next session comes along, one of the very first things we'll do probably in March of this year is a supplemental spending bill to bring us to the end of the current fiscal year, and that also tends to work against us seeking budget increases in the Medicaid program. We really do need to find ways to expand the Medicaid program, to expand the amount of federal funding that we're able to draw on, to increase our coverage rates among currently uncovered populations, like the working adult population. So we have many, many challenges. We've always had challenges in Medicaid. There is a little bit of money in the state's budget this year, and so we're hoping really to make a positive impact on funding and payment rates for physicians in the program.
So the senator also had a unique way of discussing scope of practice. We'll go to that and then we'll come back to you, Dan.
Scope of practice. Now, let me tell you what every chairman of public health and Senate Health and Human Services does when they hear scope of practice. Is it over? So when you come to scope of practice, we need to agree on things. When you move that, it's moving someone's cheese. So scope of practice will always be there, but you have my word that we're not going to do something without an agreement.
So the senator had a unique way of illustrating scope of practice and how they deal with it at the legislature.
I think her take on scope of practice and the way she reacted was dead on. Number one, I think she approaches the issue like she does all issues, and that is to tackle them head on. And I think the doctors appreciated the honesty of her response. I will say this, that in 2013, when she was chair of the House Public Health Committee, Senator Kolkhorst was the House sponsor for our collaborative bill with the nurse practitioners and physician assistants, where we, in an agreed-to manner, rewrote the entire regulatory scheme for the delegation and supervision of prescribing privileges. In addition to that, though, it speaks to the larger issue of access to care in underserved areas. And I will tell you that, having visited with a number of advocates for rural health care, for a number of advocates for expanded access to care, there are three things that we hear more often than not, and three things that we are working with them on to improve access in rural areas. Number one, it's the infrastructure issue of extending broadband internet coverage to the uncovered parts of our state, which frankly are very substantial. And it's not just so that folks can sit at home and order things off Amazon. It is to support healthcare, it is to support education. And specifically for healthcare, it's a means of extending telemedicine services to underserved parts of our state. Legitimate medical services provided via telemedicine, both primary and specialty care consultations. That also means that we need to go back and work hard on making sure that telemedicine is paid for by the health plans and by the Medicaid programs, and we'll see legislation to accomplish that. It also means going back to the legislature and asking them to restore funding that they cut in the last session in support of the Rural Loan Repayment Program. I think an $8 million investment to restore the cut funds to the Rural Loan Repayment Program quietly lets us put more than 200 physicians a year in underserved areas of our state working to provide better access to medical care, while at the same time allowing them to work off a goodly portion of their medical school debt. So it's a win-win for everyone, and we certainly would need to see that program restored. The fourth thing that's a little bit longer term is to restore cuts that we made in the last session to family practice residency programs, and frankly to expand residency training opportunities for all Texans.
And finally, she touched on an issue of great importance, the across-the-board bipartisan issue, maternal health. Let's take her statement there and we'll come back to you.
We're going to be working on some intriguing bills that take women out of when they finish that birth, they get Medicaid, and then all of a sudden then we drop them off. We're going to do some wraparound services that shepherd them through the months after birth that I think are going to be very good.
We really do have significant problems in the state of Texas with regard to maternal health. And one of the ways that we will address this is right now, currently, women who give birth in the Medicaid program, and remember, 57% of all Texas babies are born in the Medicaid program. The moms remain covered by Medicaid only for 60 days. So at the end of 60 days, they are summarily dismissed from the program. But it is this postpartum era of that where the challenge of meeting the healthcare needs of new moms is so great. And so we will advocate to make sure that there is a continuous 12 months of eligibility for Medicaid for new moms in the state, so that we have an opportunity to allow them to address health issues as they come up in an environment where they are covered and have access to those services. It's a very important issue for Texas. It will receive bipartisan support, and I know this is one of Senator Kolkhorst's key objectives in the session.
The TMA priorities we just discussed are part of TMA's Healthy Vision 2025. This week, TMA kicked off a promotional campaign to educate the public about putting the health back into health care. To get your copy of TMA's Healthy Vision 2025 detailing medicine's top priorities, visit texmed.org/healthyvision or tma.tips/HV2025 for the PDF version. The countdown has begun for the white coat invasion at the Capitol. TMA's initial First Tuesdays at the Capitol is February 5th in Austin. First Tuesdays are your opportunity to discuss health care issues with lawmakers and tell them what you believe is the best for your patients.
We need the support of TMA members to come to the Capitol on First Tuesdays and have their voices heard on this issue. And we need people who are willing and able to testify when hearings come up.
Here's a tip to make sure you continue to receive TMA's Legislative Hotline email report delivered straight to your inbox via Texas Medicine Today. First, visit texmed.org/hotline. Click on subscribe in the first story. On the next screen, check healthcare issues in the Texas legislature like this one is checked. That's it. You'll receive Hotline daily electronic reports in Texas Medicine Today. And be sure to tell your TMA friends. Well, that's all for now. Please be sure to share this video with your friends. For Brent Annear, I'm Marcus Cooper. Thanks for watching, and please join us again next week for TMA's Legislative News Hotline.